You're listening to 9 Plus, a research podcast from Waterford Institute of Technology. You're very welcome along to this episode of the podcast. My name is Rob O'Connor. I'm a lecturer in the Department of Computing and Mathematics at WIT, but I also have an interest in audio production and podcasting, hence this series and some of the others that we're producing as well. In 9 Plus, we talk to researchers at WIT about their work and their professional journey throughout their careers. In the hot seat today is Professor Niamh Murphy from the School of Health Sciences, who's also the lead of the Centre for Health Behaviour Research. Recently, she was a co-author on a paper published in the Lancet, one of the highest impact journals out there. The paper was concerned with the public health legacy of large-scale sporting events and was titled An Evidence-Based Assessment of the Impact of the Olympic Games on Population Levels of Physical Activity. But how did she end up with a paper published in arguably the most respected medical journal in the world? Niamh told me about her time as an undergraduate in Limerick, followed by postgraduate work in Queen's University Belfast, then a period in UCC before settling in WIT, with a stint in Australia for good measure along the way. To date, she's supervised over 30 postgraduate students to PhD and MSc qualifications. In full disclosure, Niamh is also my sister-in-law, as I'm married to her sister Jenny. Not that it's relevant to the conversation in the podcast, but it's good to be upfront about these things. As usual on 9 Plus, I began the conversation by asking Niamh about her current role at WIT.
My current role at WIT is I'm a senior lecturer in the Department of Sport and Exercise Science in the School of Health Sciences. I've been here for, I'm not too sure how long I've been here for, but I've been here a good long time. Before that, I was in University College Cork, and before that, I was in Queen's University Belfast.
Right. So let's transport you back in time to secondary school, and you're deciding to go on to third level. What do you do? What are you doing? What are you looking at? Well,
I was always passionate about doing physical education. It's funny, I was one of these kids who in first or second year said, I definitely want to be a PE teacher. And many people tried to sway me one way or another way, say, would you not do medicine? Would you not do pharmacy? Would you not do this, that, the other? Simply because I may have had the points. But I was always adamant that I wanted to do physical education, which is what I did, physical education and mathematics. And I never, ever regretted a day of it. That old adage that when you're doing something that you love, well, you'll never work a day in your life. And I do feel a bit like that. And even in my current role, I love what I do.
So you trained to be a PE teacher. So like kind of leaving cert Niamh Murphy is thinking about, I'm going to be a PE teacher at the local school down the road, and mathematics as well.
Yeah, I suppose I never thought about what my end job would be too much. I went, there was only one place in Ireland you could do PE at that time, which was in Limerick. That was called Thomond College of Education at the time, now University of Limerick. So I went down there and spent 4 years down there. And while I went through that, I was particularly interested in physiology, but not just physiology, the way that physiology and psychology and biomechanics all interacted. So I knew that I wanted to go on and study again. I knew I wanted to go on and do a master's or PhD, but again, at that time, it's quite different to the way things are now. I think there's so many opportunities now to go on to postgrad. So I kind of envisaged I'd work a year to earn the money to be able to pay for a master's. But what actually happened was a funded master's came up in Belfast at the time.
Okay, so final year of your degree in what is now UL, you set on the path for a postgraduate and you go up to Belfast. Okay, now how did that come about? Did you know people in Belfast? Did somebody put you on that track? How did that happen? How did you make the leap from undergraduate to postgraduate?
I started to look at postgraduate options coming into fourth year, and I actively pursued it. I thought that maybe I would end up going to the States to do it, and I started, pursuing places that I knew that other people had gone to. I also started looking at what I was reading. So the publications that I was reading that particularly interested me at the time, I started to follow those people, not on Twitter because it was harder back then, but I went to the library, I went and requested some of their papers on interlibrary loans, and I read into different areas that I was interested in. That's really how it happened. And I was particularly drawn to the area of children's fitness and physical activity at the time, and came across a couple of researchers in Belfast, Queen's University of Belfast, and then I started to see what was happening up there, and it was really through that kind of process, almost like a detective kind of a process. And then lo and behold, they were recruiting for master's students. So at the time, I couldn't. It wasn't as easy as just going on Twitter and contacting them. So I saw that there was this coming up. So I decided I'm going to go up and I'm going to try and find out what it's about. So I got on the bus in Limerick. I went up to Dublin on the bus, and then I got on the bus up to Belfast. Yeah. And I met the people up there, and they all seemed great. It seemed too good to be true. And I trekked back down again. And then when the interviews came up, I did the same again. Up I went, and I got it. And yeah, that was the way. Okay, so you were in Belfast then. So you started on a master's up there. How long were you there for? I started on the master's for 2 years, and it was a national study of children's fitness. In Northern Ireland. Fascinating study. So it was fascinating on the research side, and even more fascinating on the community and political side. So we visited, it was a stratified random sample of schools in Northern Ireland. Right. And the schools in Northern Ireland were broken down into Protestant and Catholic. You didn't call them Protestant and Catholic, called them voluntary and maintained schools. And then that's a very passive aggressive statement if ever there was one. Yeah, okay. Well, because the way it was the Protestant schools were state maintained, whereas the Catholic schools were considered voluntary. They had a voluntary alignment with the Catholic faith. Right. And then you also had another division, which was the grammar secondary school division. So at the age of 11, every child up there does the 11 plus. If you are in the top 25%, you go to a grammar school, and everybody else goes to a secondary school. So you have a two-tiered system both ways. So fascinating. The other thing, from coming from the south, was that up there in the north, every school got better funding than any school down south. So we were going around schools for a year. Every school had free school dinners, had fantastic facilities, for PE. So it was a great eye-opener. It really opened my eyes to more than just looking at fitness in children. It was all about environment. It was about the social environment that people found themselves in. It was about religion, and it was about politics. And so it really opened my eyes to what shapes a person, really. You might not be able to remember this, but I'm just interested. Was there any difference in the physical fitness levels between the grammar school students and the secondary school students? I do remember it because, and if I look at it now, it's hard to even talk about it. This is 25 years ago, is it? Yeah, it is 25 years ago, maybe even more. Yeah, no, it's about 25 years ago, 25 to 30 years ago. And at the time, there was a difference between the provision, first of all, in the Protestant and the Catholic schools, and a huge difference in the grammar and secondary school provision for facilities and so on. And yes, the fitness levels were different. And not only, we also measured physical activity levels, and we also measured associated health indicators as well. And we did find differences. The interesting thing was that we were not encouraged. That's being politically mild about it. Okay. We were not encouraged to publish those differences. So now I wouldn't sign up to that, but that's easy to say. But it was a different political climate at the time up there. Yes. So some of that stuff was not published because it would have been very politically inflammatory. But it was, again, very interesting learning, and I probably wasn't experienced enough at the time to really see all the nuances in it, which I can see now. Yeah. But yeah, very interesting. What is the relationship? This is a silly question, but I want to ask it anyway. What is the relationship between physical activity and associated health benefits? Well,
or associated health status.
Yeah. Well, physical activity has huge health benefits. So when you're physically active, and there's physical fitness and physical activity. So physical fitness is, you can measure physical fitness. So you'll be looking at cardiorespiratory fitness. So how long can you keep going for, your endurance levels. But there's other aspects of fitness as well. So there's speed and there's flexibility, etc. And power. So you can measure those things. Physical activity is a behaviour. It's the stuff we do every day. You know, how much do we walk? How much do we move? And physical activity, particularly, quite distinct from physical fitness, has an impact on health. So it helps to reduce the risk of cardiovascular disease. It reduces stress. It improves our bones. It improves our cognitive functioning. So it is associated with a whole myriad of health benefits. And the evidence around this has been growing hugely, particularly over the last 30 years as the rigour around the research improved. But it's kind of unequivocal now. We know it for sure that physical activity has incredible health benefits.
So you talk about the change in attitudes over the last 30 years. So during your professional life. So when you started out professionally in this area or as a postgraduate student, the idea of somebody going for a walk being good for their overall health, would that have been a generally accepted truth?
No, it wouldn't. So I ended up doing my PhD in osteoporosis in older women. So here's an example.
Okay, right, yeah.
So if a person, an older woman or anyone else, went in and had a hip operation, they were assigned bed rest for a week. Now, if you have a hip operation, that same day you will be up and moving. So we know now the benefits of moving are really, really important. So it was definitely, especially amongst the medical profession, not at all an accepted methodology for improving health, for physical activity. And in fact, now we might think that everybody knows physical activity is good for health, but I'm still very involved in advocacy and policy generation to try and embed physical activity, particularly in the medical services, because the role of physical activity, it's kind of everybody's business, but nobody's business. And it really is not, it's not afforded the same level of importance as, for example, nutrition is. So, for example, one of the big global policies which governs the way that every country in the world invests in physical activity and in nutrition, and the global policy on diet and nutrition, there was, about 4 times as many dietitians involved in formulating that policy as there was physical activity people. So we're still battling to try and make sure that it gets the evidence, or that the evidence is embedded in practice.
Why do you think that is?
I think it's, the cynic in me might say it's because it's free. Okay. There's not a whole pile of money to be made off physical activity. I think that we need to be better advocates. I think we need to club together more. And one of the things I'm very involved in now is a group called IPARC, the Irish Physical Activity Research Collaboration. And in IPARC, we are pulling together policymakers and practitioners across a whole wide range of areas. So from health, from sport, education, planning and environment, all of these different areas, all of whom have a role in helping to make physical activity part of our daily lives. So, when we build a road now, we tend to put a footpath alongside it, and we hopefully put a cycle lane. But we need to pull together to do that, and we need to advocate all of the time with government. But there's a sea change at the moment, Rob. It's a time, I'm quite amazed to be living through this now, because maybe the climate agenda has pushed it forward, which is fantastic at last, because, I've been doing this stuff for 30 years now, and it's been a battle all the time, but there's a real sea change at the moment. And I think it's something that our students, I hope, are excited about. Never before has there been such opportunities in the area of physical activity and health.
So let's back up to your time in Belfast. and you're working on this study and you're doing a master's. Did you finish that master's?
I did, yeah.
And what did you do next?
Well, while I was doing that master's, I was also running. I was an athlete, and I was running at quite a serious level. And I then got a job in Queen's University working as an exercise physiologist, and I was doing a lot of work with elite athletes. I also was doing some work, kind of corporate wellness work, at the time. And I started to help out a medical doctor who was doing some work up there, and he was interested in physical activity for older women. I was interested in bone health from a different perspective, from an athlete perspective. So I was delighted to get involved with him, and I got very interested in the similarities and the differences in working with different population groups. And I ended up doing my PhD in that area. And what we did was we recruited a group of older women, the age between 72 and 84, from all over Belfast, but several of these women were from a very disadvantaged area of Belfast, Divis Flats, you may have heard of Divis Flats, and other areas. And we used to bring them into university, and we'd do a strength training and aerobic training programme with them, and we'd measure bone health and other parameters as well. And we saw massive improvements in strength and in bone density in over the 6-month period that we measured them. So it was an absolutely fascinating study. I'll tell you more about what happened afterwards if you want. We also measured a whole load of biochemical markers and issues like that as well. So that really was I did my PhD in that area, as I mentioned.
And you did the PhD in Queen's as well, was
I
it?
did.
Yeah,
I did.
Yeah. So again, I don't mean to be utilitarian about these things, but I just kind of want to bring it back to kind of some aspect of practicality, or looking at a problem and a solution. Maybe that's just the way my brain works. So the idea is, again, if an older person has a bone break, particularly later in life, it's much more serious than if I have a bone break right now. Would that be fair to say?
Yeah, absolutely. And the fact that you may have a bone break later in life, it's probably related to the amount of physical activity that you did early in life.
Okay.
So what we know is that there's a critical window. So if I just talk about women maybe initially, but it's the same for men. Up until the age of 30, we used to think it was even earlier than that, up to 20, but maybe it's up into your 20s. You have this window in which you can increase bone, and if you miss that window, if for some reason your bone health is compromised, and it can be compromised through poor eating habits or through lack of physical activity, for example, and other medical conditions also, but it can be compromised, and if it is, you can never catch up. So you reach a certain peak bone mass, and thereafter then bone mass will decline naturally over age. Right. So, but if you can reach that high peak, well then, and if even with the decline, then you're on a higher level to begin with. So so that was the PhD, and started doing that kind of work. But what really struck me about that PhD, not that PhD, but the one of the studies in that PhD was we brought people back 6 months after the end of the study, and I was very struck at the very rapid decline in the majority of people over time. In bone health, it was one of the markers, and in other aspects of fitness, but more importantly in their psychological well-being. They had missed the connectedness with other people, and I felt guilty about it. I said, this isn't right that we would do this kind of a study and drop people. So I became more interested in not just the efficacy. So we knew that this exercise regime worked, but what makes this exercise regime work over time? I'm more interested in what we would call effectiveness over time, rather than just efficacy in a controlled situation. And I was really curious about the people and why certain things worked and how they worked. So I really realised that, it's the public health element of that really drove me and made me curious and made me want to do more, which is why I transitioned more into the public health side of what happened.
So if I'm picking you up correctly, so you had done this study on older women and their bone health, and you had, as part of the research, done an intervention with respect to strength training and physical activity and fitness, and you noticed that there was a positive impact through that intervention. But then the study ended, They went away, and then you just checked in on them then months later, and because the direct intervention wasn't there, everything declined. Yeah. And that really kind of sparked an alarm bell or something in your head that maybe there's something here that we need to go further with. Yeah.
And that really leads me to where I am now. Okay. I'm currently the co-course leader of the BSc in Public Health and Health Promotion here in WIT. I also work in the Centre for Health Behaviour Research with lots of my colleagues here in WIT, lots of people who do great work like Paula Carroll and Barry Lamb and Aoife Lane, who used to be here in the past, Michael Harrison. So one of the things that really drives all of us is the pragmatic side of the, it might be exercise, but community-based health promotion pulls us all together, because it's about what works. Yes, it should be evidence-based, but it's about how does it work in a real-world situation, and what should we do? What do we need to do to make sure that it's sustainable over time? There's no point in having a bells and whistles intervention if it just fades out, once the research team goes away. So
it's a crude analogy, but would this be? It's January. I have a New Year's resolution, and I go for a run for the first 2 weeks, and then I stop and I'm just eating biscuits on the couch again. But I've done a great big Herculean effort in the first 2 weeks. But whereas I'd be much better off going slowly and continuing it. Would that
Exactly. And one of the things in our field is, in the field of public health promotion, a lot of the time when students come onto the course, they think, it's about helping people change their lifestyles. And it is. Yeah. But it's about a hell of a lot more than that, because we keep on throwing it at the individual and expecting the individual to take responsibility for their own behaviours, health behaviours and other things. But we have to put the scaffolding around them to make it easy for them to change those behaviours.
Yes.
We need to have the environments and the supports and the policies around them that, look, so for example, if you're in a workplace, that, you have a flexible lunch break that allows you to go and exercise if you want to. That you have a flexible time that you can go and collect your kids, and that you're looking after your mental well-being as well. Those kinds of things so the easy fix is to keep on going lifestyle.
Yes.
But the harder, longer term fix is to really think about all of those other environmental concerns and other social, we call them the social determinants of health, that we need to look more broadly. And a quick flick back to that PhD again, I really started to realise, something. There is more to this here than just the exercise. It's about more than just how many reps you do and how many minutes you do of X amount of physical activity at this percentage of heart rate. It's about so much more than that, and we need to really try and look at it holistically.
In the same way that you talked about the nutrition and just the way that you have described the physical activity, and I'm only asking because I don't know, might the reason that the emphasis was being put on those things was because it's easily measurable?
Exactly.
They are inputs that you can measure, whereas what you're describing is a much more holistic view of physical health or just general health, mental health as well. Whereas there's a lot of aspects that are intangible. You can't put an input in or press a button and get a reaction.
That's absolutely right. Okay. And it's so much harder and takes so much more effort to do that kind of work. So one good example of this, Rob, would be a fantastic PhD student here in WIT at the moment, Aisling McGrath, has been doing some great work on a project called Sheds for Life, which is with the Irish Men's Sheds Association. And Aisling, the amount of groundwork, the work that nobody saw, where she was out in the sheds talking to the men, understanding what the men's needs were, establishing relationships, understanding what will work and what won't work over time. That kind of work is really what what makes our work and makes a difference. But it's sometimes the stuff that people don't see. So it's incredibly difficult to do it. And that's why, yes, it's intangible to a lot of people. They don't get it. Yeah. And they're not willing maybe to invest in that time to make sure that things work later on.
Yeah, and of course, if you're trying to put that on a spreadsheet, it doesn't necessarily add up. But I understand where you're coming from. I can totally see where you're coming from. We might just back up because you've invoked your time in WIT, but in the story, when we last talked to you, you were in Belfast. So how do you end up going from Belfast to WIT? How'd you get from there to here?
Well,
I know it's not direct, but go on.
Yeah, I suppose life kind of takes over. I was still running quite a lot, and then I was also about to get married, and we were thinking about where we'd like to live, and then a post came up in UCC. So I worked down in UCC after I moved from Queen's to a post in UCC. And down there I was again doing some testing work, elite athletes and corporate wellness work. And I was also starting to teach a little bit with the physiology students and the medical students. And then I moved to WIT after that, another post, yeah.
Okay, so and what year did you move to WIT, do you remember?
Good question, I have no idea.
Okay, it's probably late 90s, is it early 2000s?
It probably is, yeah, probably the 90s, yeah, late 90s, yeah.
So, something like that, okay. So now you're here in WIT and you've mentioned an awful lot of the people that you're working with. You've mentioned some of the groups and you've mentioned some of the people. Actually, I'll kind of do a little kind of an aside link to the podcast we recorded with Evan Matthews there a while ago. His study looking at physical activity and the positive effects on mental health, which you're kind of involved with in the periphery as well. So that's a kind of a thing. Things are related here. So we started the piece by talking about this Lancet article. Now, there's a number, so this Lancet article, an evidence-based assessment of the impact of the Olympic Games on population levels of physical activity. Now, there's a large number of authors to this paper. You're one of them. Could you maybe describe what that is, what the perceived wisdom is, what you found out, and how all of this came to be?
Absolutely.
Now, I know that there's a lot of questions there, but I'm asking you to tell me the story of this paper.
Yeah. Well, first of all, this paper, I don't think I should retire after it. I never thought I'd see my name in a Lancet article. But as you rightly say, there's a lot of authors and there's a lot of years of work that led to this article. It was led by Professor Adrian Bowman from the University of Sydney. And in 2005, thanks to one of the funding opportunities here in WIT, the Strand 3 programme at the time, I was afforded the opportunity to spend some time in Sydney with Adrian. Now, that again came about because I started reading Adrian's work. I really liked his approach. He was very pragmatic, very community oriented. So I had read a lot of his work. I contacted him. I said, could I come and work with you? I, at the time, had 4 young children. We'll talk about that again. I suppose I didn't think about those kind of logistical things too much, but WIT were incredibly gracious in this and allowed me the time to go and to learn over there. So Adrian mentored me over there for a year. While I was there, I published a paper which was about mass events. So by mass events, I mean things like Olympic Games or even things like, big community runs, and it was, are they bred on circuses or are they genuine kind of health promotion opportunities? Okay. So that kicked it off. I wrote a paper over there with Adrian and that kicked off another area of research. I came back, applied to the Irish Research, the Sports Council at the time, got a fund there, took on another PhD student who was Aoife Lane, at the time a magnificent PhD student, and we published several papers on events, Olympics, but other mass events and how they impacted population physical activity. So when this Lancet article came around, I already had maybe 6, 7, 8 published papers in this area, and all with Adrian helping things along in the background, as he has helped many other people in many other places. So this article in the Lancet has been a long time coming. We have tried before unsuccessfully to get an article like this into the Lancet, and then it coincided with the Olympic Games and it was an incredibly long process to get it in, but it was just fantastic to see it in there. And the question we were asking was, so there's an awful lot of rubbish spoken about big events and the sort of thing that elite athletes will inspire a generation to become more active. The London Games, London Olympics based their whole, messaging around this. It will inspire a generation. So this is the question. Well, do people get inspired by elite athletes? I'm not too sure they do. Is there a trickle-down effect, in other words?
Yes.
So we have published a few papers on this. So is there any evidence that an Olympic Games makes the population more active? So what we did was we said, let's empirically try and measure this. We went back trawled through all the Olympic documents and went to see what they promised. We then looked at which countries actually measured population physical activity, and was there any evidence that this happened? And the upshot of it is that in a couple of those places, they did manage to improve physical activity in the population, but for the most part, no. There is no evidence that an Olympic Games will inspire a generation to become more active.
Okay, so you're largely looking at the 2012 London Olympics, but you also mentioned Adrian Bowman is based in Sydney. So would he have been able to draw on data from the 2000 Olympics? What's the 2000 Olympics in Sydney?
So we actually went all the way back. We went back to way before the London Olympics actually, and we looked at data from any games for which there was data, basically.
Okay.
So it was a huge piece of work, and that's why there's such a big group of people from Brazil, because of the Rio Olympics, and people from Beijing, because a lot of those documents wouldn't be translated into English, and so on. And even from you're talking about the Winter Games also, Nagano, Japan. So there's a great Japanese co-author there who looked at that. So it was a big undertaking, a big piece of work, to do it, to actually analyse the data. And I won't go into all of the detail of the paper, but one of the things is that there is no evidence that there has been an impact of Olympic Games. But that's not to say that there couldn't be an impact if public health agencies worked in conjunction with sport agencies who worked in conjunction with the people building the facilities.
Yes.
So there is opportunities, public health opportunities there for sure.
So you said that there were some cases where there was a positive impact from the Olympic Games. Where were
Beijing?
Those?
Beijing there's some evidence, that they did things quite well. Nobody though has done it ideally.
Okay.
So there's little pockets of good practice from London, pockets of good practice from some of the Winter Games in Canada. So, it's not to say that everybody's done it really badly. No, they haven't.
But the idea that having an Olympics will increase the fitness and health of your population is not true. You're shaking your head.
No, it isn't. Yeah. But we could get our act together and it could help. If it was harnessed in the right way. So we probably need to think about what is it that helps people to be more active. So there is some evidence that role modelling can work, but it needs to be done in a particular way. Yeah. So elite athletes, possibly they could be role models, but currently they're certainly not harnessed in that way.
So to go back to something you mentioned earlier, so you are an athlete, and you're talking about the Olympic Games. So you're talking about kind of elite level. But when you're referring to physical activity, you're not talking about somebody going off and running a marathon. Or going off and lifting 6 times their body weight, or whatever the hell it is. I don't know these metrics. You're talking about it doesn't have to be those large scale events. It can be as simple as going for a walk. Absolutely it can. And I mean, that's probably the more healthy end of the range. What elite athletes do is probably not in the long term. You can't keep doing that up for your whole life. Your body probably wouldn't be able for it. I'm talking about the more moderate, the stuff the everyday stuff, the going for a walk, the interrupting, the amount of time you're sitting down. Yes. Just those basic things. Yeah. Yeah. Okay. So the Lancet paper, when was that published? That was published just last year. Last year. Okay. Yeah. And what has there been any fallout from that, or has there been any impact because of that paper? Well, or anything you've noticed? Now, I do realise we are living in a COVID world. So in a normal world, you would have gone to conferences and done this, then you would have been meeting people. You haven't been able to do that. Okay, so I do appreciate that. What have you learned from the paper now? Well, one of the things that the only thing you can do really is to try and see, can you influence policy going forward and practice going forward? And it's probably too early or too late at this stage, for the Paris Olympics, which is the next cycle. But the time at 4 years after that, it's going to be in the USA again, in Atlanta. So it is to try and think about the organising committee for an Olympic Games would need to prioritise population
health and population physical activity if they were going to, and they need to put the things in place now, really, going forward.
And what are those type of things?
Those kind of things are, first of all, surveillance systems. So being able to measure whether you're having an impact, and often they're not good enough in different countries. So start measuring now, what is the physical activity of the population, so you can see then down the road if you've had an impact, and keep the same measures over time. That's one of the things that people keep doing, is changing the measures over time.
Oh, so you can't compare them.
Yeah, you can compare them, so you don't know where you're going. So surveillance systems would be one important thing. Planning systems whereby you have that connectedness. We would call it systems thinking, where you try and join up the people from planning and from sport and health and all the other agencies that are work in silos a lot of the time. So you need to do that over time, because people need to get to know each other, you need to build trust and so on. And then you need to prioritise the involvement of the population. So in some cases, Olympic Games have been incredibly elitist. So if you look at what happened in Rio, I mean, really the average person was completely left out of anything to do with those Olympic Games. They couldn't afford a ticket.
Yes.
Whereas in London, they did a really nice job of having a lottery. I think you were there, Rob, and I was there.
Yeah.
And you will never forget it. It was incredible. But they also, one good thing they did in London was the whole volunteer side of things. They invested in training volunteers. So you could get involved in many, many ways and be inspired. So it wasn't just about the elite trickle-down effects. It was involvement all the way through. So there's some of the things you could do.
So, okay, again, I'm using a crude analogy, and if this is wrong, please just point it out to me and tell me, right? But I'm trying to... I was listening to a piece on the radio the other day, and they were talking about, people need to give up their cars and all this kind of stuff, right? Which I totally understand. I get it. But there was another person on saying, well, yeah, but I would love to use public transport, but there is no bus available for me to get, so I have to have a car to get into work. Is it kind of like that? It's like, okay, you can put up your carbon tax, which is going to be your stick, but you have to give me the carrot of having a public transport service available in order to use that. In the same way that when you're talking about public, it's no good saying you all need to be healthier and fitter, but you have to put those places, those supports in place before you can just crack the whip. Is that
absolutely
kind of
you've got it exactly right. I mean, you have to put those supports in place, and the last thing you want to do is really annoy people by saying, oh yeah, I'll have to take the bus, and then there is no bus. But you do also need to do the unpopular stuff and put in car restrictive policies as well at a certain point to tip things over. Some really good examples of this. So people always talk about the Netherlands, and they're a long way, or Denmark, they're a good long way down the road. But what if we take somewhere like London or Paris? There was huge resistance initially in Paris to, they made the banks of the Seine one way first. And over the past 5 or 6 years, they've made huge strides in getting more people out of their cars and onto bikes and onto public transport. But they made some, at the time, they were unpopular decisions. But now, people can't imagine it going back.
Yes.
And London have done the same. They have taxed people for bringing their cars into the city. Huge backlash initially, but people get used to it. Yeah. So you have to do both. It has to be a carrot and a stick approach. Yeah. But initially, you don't make everybody's backs up initially by putting the restrictive stuff in first. Try and make it as supportive as possible first, and then. But you have to do both.
Which is where you come from about getting the various stakeholders who may be in disparate groups talking together before you push forward. And maybe identifying those groups is often probably the hard part, is it?
Yeah, it is. And actually, on that very thing, Katrina Kaur is a PhD student with us at the moment, and also Dylan Power is doing an associated piece of work. But Katrina's doing some great work. She's now working with Kilkenny County Council, and she's working on developing a cycling culture in Kilkenny. And she is connecting all those different groups, and she's also kind of making a sustainable template so when she leaves and when she's finished her PhD, that it will continue in this particular way. And it takes time. There's a trust building, a capacity building process initially. Now we've that's been incredibly fortunate because it coincides with the climate agenda, and moving towards this sort of 15-minute city kind of a model. So that's an example of she's doing helping to implement a lot of these kinds of policies. Yeah.
Okay, so I can see where you're coming from, and anyone who's been around any town or city in Ireland, and you can see where some things are being put in place. But I suppose often my criticism of things is where you'd have a cycle path that's 500 metres to nowhere. You have a little bit and then it ends, whereas you can't really go anywhere with that. Whereas when you have, say, for example, a cycle path that will take you from point A to point B, I've noticed that they seem to be used. Is that...
Absolutely, yeah. And it's about that joining up those bits of networks. And some of them look simple, but they're actually, when they come to being implemented, are far from simple, because there might be one agency who had responsibility for building it at the time, another agency is responsible for maintaining it. So the joining the dots bit is actually the bit. So we call that in health promotion, we call that to mediate, to be the middleman to join those dots. And that's partly what Katrina's doing now. But it's one of the core skills of a health promoter to be able to do that and to empower different groups to be able to take these things on,
So again, it comes back to those intangible things that you were talking about earlier that are maybe a bit muddy. It's very hard to see them. Yeah, okay.
Yeah. I'm probably making my research sound very intangible and very airy-fairy, but it's far from it. And the beauty about doing this kind of research is that you see the real-world impact of it. I look at the work that Aisling has done in the sheds and the incredible impact there. I look at Katrina and the real, you see it with your eyes. After time, you see what's happening. And that work didn't just happen out of the blue. 5-6 years ago, Barry Lamb did his PhD on that exact thing. How do we promote walking, cycling in Kilkenny? And we did a great piece of work there. So it takes a long time, for sure.
Yeah.
I'll be retired probably by the time we...
But you might be able to enjoy some of the cycle paths and other infrastructure that's put in. Right, there's a lot more that we could talk about, but I'm just mindful of time as well. Okay, so I'm just going to ask you about two more things. Okay, so the first one is the networking effect. Now, you've mentioned Adrian Bowman in Sydney, and you've mentioned researchers in Brazil and China and various other places. You've had quite an international life of a researcher so far. I mean, could you maybe describe even one of the networks that you're working with right now? You're working with some
I work, say, for example, with the HEPA Europe network, the Health Enhancing Physical Activity Network in Europe. Yeah.
Okay. And so what's that?
Well, that is literally an informal network of researchers. It's actually under the auspices of the World Health Organization. They are the organising group, but it's completely and utterly voluntary. So probably, in Ireland we are good generally at connecting with each other and about just saying, hi, I'm working in this area and can I tag along? Yeah. So sometimes that's enough. And people are usually very open and willing to help. And from my experience, the most expert people in the world will be the most open people also in the world and always interested in learning. And that's... I love this. It's my passion. So with the HEPA Europe network, it is a group of people who we have a very low-key kind of a conference every year. We literally spend a lot of time networking and talking to each other. Yeah. And actually just this week, we're just about to embark on a new research project as part of this. Evan is involved, who you mentioned earlier on. And it's about mental health within communities and how physical activity contributes to that. And it'll be an exciting piece of work that will happen over time. That is an informal idea that came from a connection we have with some researchers in the Netherlands. And now the World Health Organization have said to us, we're really interested in this. Would you think about bringing on another couple of countries? And we said, yeah, great. So, and then because you know people in other countries, you can just pick up the phone or drop them an email and say, we're going to do this. Are you interested? And usually people go, yeah, great. So it literally happens that way.
And you're also involved in a kind of an Irish-American
That's
group,
right.
Teach Collab. What's that?
Yes. Teach Collab is a collaboration with the University of Washington in Seattle. And this happened, I'm trying to think how it happened. It happened actually initially through a visit from the University of Washington here to WIT, and a connection with the School of Health Sciences, some individuals. I think personal relationships matter a lot, actually. So that's a connection between Jodie Early and other colleagues now that we've gotten to know since. And we have a funded Erasmus programme now, where this year, just in a couple of months' time, we've got 2 WIT students going over to spend a couple of months in Seattle, and 2 students from Seattle coming over here, and they'll cross over in both places as well. So that's a fantastic project. They're actually working with community partners in the area of health promotion. They'll get involved in some research work also. And also as part of that, we're trying to embed what we do in the curriculum, and try and make sure that all of our undergrad students benefit and experience what it's like to be a student in another country, and also what it's like to experience healthcare and other health-related issues in another country.
From talking with you today, and also the various other people I've spoken to on the 9 Plus podcast, if there's one thing I've learned about research, it's that this sounds like such a simple thing to say, but communication is key. It comes down to communication. Everyone talks about, I spoke to this person, or I was in touch with so and so, and we got together and we talked about things. So many things seem to be happening from just conversations.
Yeah, I think that's right. And I think
personal relationships, as you mentioned.
Yeah, personal relationships. And sometimes that can be daunting. Maybe as an undergrad student, you say, I don't know anyone. Or I certainly remember really looking up to certain people. Like, for example, Adrian. I mentioned Adrian Bowman earlier. And he couldn't have been more welcoming. And I remember being over in Sydney, and there was an informal soccer game in the School of Public Health. And I looked around, and I knew there was about 6 people there, and I had read, all of their papers, and I thought, oh my God, I'm overwhelmed here. And they're just people.
Yeah.
And I think curiosity goes a long way too, and just not being afraid to say, hello, I'm such and such, and I'm very interested in. And most people will be very willing, I think, to chat to a student. So I normally ask people at the end if they could offer one bit of advice for somebody who was thinking about getting into research. What would it be? Would it be what you've just said? I would say start by talking to the WIT staff here. We have a wonderful research active staff in WIT. So one of the great things about WIT is that everybody is so accessible and so open. So chat to your staff members and to your peers as well. Start there, and people would be very willing to help. Yeah. Absolutely. And there's nothing wrong with going for a cup of tea with somebody as well. Absolutely. Yeah, there's a lot to be said for that. Niamh, thank you so much for speaking with me today on the 9 Plus podcast. I mean, there's plenty more we could have discussed, but I'm very conscious of time here. If somebody wants to find out a bit more about you or follow your work, what's the best place for them to do that? Probably just go on the WIT website, and you can just Google Niamh Murphy, WIT, and my staff profile is there. My email is nmurphy@wit.ie, and I'd be delighted to hear from anybody. I'd be delighted to talk to them. Excellent. Wonderful stuff. Niamh, thank you very much. Thanks a million, Rob. Thank you for listening to this episode of 9 Plus. You can follow us on Twitter at 9 Plus Podcast, and if you're feeling generous, a 5-star review on your podcast platform of choice would be very helpful. We'll be back with another episode next week.